Guys, so it is about 8:15 in the morning and I just got to work. I got to work a little bit early so I can kind of set up for my day and kind of show you guys how I do that. I just got in my little office here that I share with the provider. I sit right there. And when I first get here in the mornings, I grab my encounter forms. Now I'm just quickly punching in and also checking to make sure the first patient of the day is not here. Normally the first patient arrives at 8:30. It's probably about 8:20 now. So I'm just making sure they're not here and sitting in the waiting room waiting. So each of our providers here at the clinic that I work at have their own hallway. We each have 3 rooms, sometime 4, depending on the hallway that you work down. I only have 3 rooms down my hallway. So now I am just gonna quickly get the room ready for the first patient. And the first patient that we're seeing today is a baby. So I'm gonna get everything ready. I put the fresh new scale paper on, grab all my supplies that I need for vitals, and also I like to start the computer because I feel when I'm rooming sometimes it takes a while to start the computer, and I like to get things going so that way I spend less time in the room and we don't end up falling behind because of computer issues. After I set up my room, I quickly check again to make sure the patient's here, and they are. So now I'm gonna put on all the PPE that I need to safely room this patient. This includes an N95, an extra mask, gown, and gloves. So rooming a patient consists of getting vitals, blood pressure, heart rate, respirations, height and weight, reviewing your allergies and any new medications that you're taking. Also, any concerns that you might want to mention before the doctor goes in. I gather all this information in the rooming process. So because I work in a pediatric clinic, administering vaccines is a big part of what we do here. So after I am done rooming, the doctor goes in and I wait for her to put in the orders before I grab the vaccine. Once I grab the vaccines, I draw them up and I wait for her to come out of the room before I go in to administer the vaccine. Depending on the specialty clinic you work in as a medical assistant, you can perform a bunch of point of care testing. Some of the tests that we do here at the pediatric clinic is hemoglobin test to check your iron levels, lead tests. We do strep tests, flu tests, cholesterol tests. We check your eyes and your ears, urine tests, pregnancy tests, just to name a few. So after I'm done drawing up my vaccines, I kind of check again to make sure my next patient's not here. And if they are, I just go ahead and room them. And if they are not, I just sit and wait for the doctor to come out. So after each patient leaves, you make sure to clean the room thoroughly and get them ready for the next patient. So you pretty much wipe down all surfaces of the room, all your equipment that you used for vitals, any equipment that the doctor might have used during the visit, keeping everything nice and clean for the next patient. And also because of everything that's going on with COVID, you want to make sure that you're being safe and also that you're keeping your patients safe. So guys, it's like 12:02 right now and I'm headed to lunch. We all go to lunch from 12 to 1 p.m. Our last patient of the day, well, of the morning, is at 11:30, and then the next patient is at 1 p.m. So get a quick, nice little break until our afternoon starts. So I'm just gonna grab some food and then we will start our afternoon. So I just got back from lunch, guys, and our next patient is not until 2 p.m. It's a Tuesday. I'm not sure why, but Tuesday is normally a slow day for us. On a good day, we see a total of 15 patients, one every 30 minutes. But today we're only seeing 9 patients, and that's okay because now I get to stock when I have a little downtime. I also like to do refills when I have downtime. I also go around and ask my coworkers if they need any help with anything and just kind of do stuff to pass the time. So guys, this is a very small lab where we run all of our point of care testing. This is one of my coworkers. She was happy enough to help me out with this vlog and let me film her. She's about to do a urine test, and also she's gonna package this sample up to be sent to the main lab that perform tests that we're not allowed to perform in this small lab. Also guys, all the point of care testing that I mentioned before, this is where we do all of those. So guys, it is about 4:50 and clinic is almost ending. We just have one last patient here, and since I'm the closer today, I'm gonna go around and check on everyone and make sure no one needs anything, and I can close up all our vaccines and all our lab supplies and turn the lights off. So guys, it is 5:25 p.m. and I'm just leaving work. Normally on a good day we end at 5 p.m. or a little earlier, but I mean, things happen and things get added on at the last minute. We literally only had 9 patients all day, and we had, the last patient was at 4 p.m. and we had 4:30 added, so that kind of pushed us behind a bit, but that's completely fine. I really like my job. I really like what I do, the people that I work with, so if I have to stay back a little bit sometimes, I don't mind. It's not the end of the world. And I feel like it kind of comes with working in the medical field, because anything could happen, you know? You can't just say, okay, well, my shift is done, I'm gonna leave. No, you have to do your job. So I'm gonna end the vlog here because I am headed to class. Thank you guys so much for watching. I hope this video was somewhat entertaining and informative. I wish I could have vlogged more, but I couldn't because HIPAA, and I couldn't put any patients in there or anything like that. Any suggestions on any other videos that I should do, please let me know. I am open to suggestions or whatever you guys want to see. Thank you so much for watching. Don't forget to like, subscribe, and comment, and share it with a friend. And I will see you guys next Wednesday. Bye, guys.